some wonderful, wonderful nurses. We have doctor. We have clinical professional. It's going to be an interesting one, and I'm sure we are like my stand is fine. All right, delete.
What happened to your sound? No sound.
All right, there we go. All right, you can hear me now.
Yeah.
You should be able to hear me now. All right, so thank you for joining me. I have some wonderful people here this evening. I have nurses and clinicians and the professionals joining me on this very special broadcast. As I said, we want to talk about COVID, what the experiences have been, what your life has been with the COVID experience as you encounter it during your life experience on the job. So we have some special people. We have Dr. Kathy Ann Pate Robinson. She's joining us from Jamaica. She's joining us from Jamaica, and we have Shanique and Angela. We have Alderine. We have Violet. We have Lady, and we have Cindy, and we have Maxine. Let me see anybody. So everybody now. All right. So I am interested. I'm interested in finding out from you what your experience have been with this COVID as you gone through this period. It has been a challenging time for some people. And by the way, I know most of the people. I know most of the people because I have worked with everybody here at one level or the other. So I am very familiar with these people, and I don't know what's going on with this sound pattern here. There's a lot happening, which is not good.
Probably my background.
All right, so we're gonna start off with Cindy. Hi, Cindy. You can hear me now, right? So tell us a little bit about you. Tell us a little bit about yourself. Now we're not gonna say where we work, but we just want to say a little bit about who we are, that others can get to know who we are. All right.
A hospital that's close to the beach. I am not a nurse. I am a secretary on a med-surg unit. Um, we go back to COVID in March, I guess it was, where we had our very first case. It was the very first case there at Queens, and it was very, very scary. We didn't. There was a lot of unknowns. The initial patient that had come in came in as a like rule out TB. We didn't even know it was COVID, and we ended up being a designated floor for COVID patients. And it was definitely a scare, not knowing what to do, how to treat the patient. Everybody was scared to be anywhere near the patient's room. Or I mean, I remember there was a point where even our own staff members, would bypass our floor. Or if we were into the lunchroom, they're like, oh, you're on the 10th floor, you guys got the first COVID patient, we're staying away from you. So it was pretty rough.
Pretty rough. Pretty rough. And we'll come back to that. We'll come back to that because I been there, done that. So let's go around and say and tell us about a little bit about who you are. We have one doctor. We're going to keep the doctor till last. So let's go to the other two nurses. Let's go to Angie and Shanique, who are sisters by each other. They work together at the same hospitals on the same floor. That much I know. So we can say, tell us a little bit about who you are. These are RNs, and we're not going to go to the detail of your COVID experience yet, but tell us a bit about you. Hold a second. Let me get you there. Sorry, let me get you. Let me unmute you. Let's go. Go ahead.
So I'm the baby nurse and she the senior nurse, and we basically work hand in hand. Like whenever she's on duty and I'm on duty, it's like we're teammates. Whatever she needs help with, she calls me. I called her. I guess I called her more.
Go ahead.
My name is Angela, and I work with Shanique on the med-surg unit. She called me the old broom because I've been here for a long time.
There's a saying where I'm from that old room knows all the tricks. So anytime I need like reference or anything, I go to her. I said it with utmost respect.
Understand.
So we went through the COVID experience together. It was a learning experience. It was a little in the beginning because I think we were at war that was here, and we didn't know where the enemy was coming from, how to deal with the enemy, you know. So now, we learn more. So so now we know the enemy. It's still lurking around, so we still have to wear the mask, do the same social distancing, so it's, what else can you say?
I mean, it's a learning experience. We have to adjust to this new lifestyle and all these changing regulation, but we're just thankful that we're able to be of help to the wider society. And at the end of the day, we learn a lot. It even embraces a lot of teamwork. It shows the power of working together as a team. It brought a lot of us closer. And for that, even though it's very challenging and rough, we still find ways to be grateful and find joyful moments to carry throughout the day.
All right, thank you on that. I can't wait to see what the personal challenges have been for some, but we'll get there. Maxine.
Yes, sir. Good evening, Bishop, Dr. Beckford. First of all, let me say good evening to my fellow peers that are here on Let's Talk, and to all the healthcare heroes and the essential workers around the world. Let me just say thank you for all that you do, and thank you for all that you continue to do in these unprecedented times. Today, as we know, actually marked 1 year since the first COVID case actually was identified here in the United States, and specifically in Washington State. So just very quickly, keeping it simple, my background is critical care and emergency medicine. I am a nurse executive. I work for the federal government. I am one of few nurse executives that actually have a clinical background and still work on the clinical side. It has been very challenging. It reminds me personally of being at war. It is reminiscent of my deployed experience as a soldier. We have learned a lot, as some of my peers have stated, but the key to all of this is we evolve our standing operating procedures as we went along, and as more science and information came to being, identifying that this is what, in fact, we were dealing with and still is dealing with. Personal challenges for me was wrapping those bodies. Of course, over my many 20 years in healthcare, I've wrapped many bodies, but this again became for me reminiscent of being in the war zone, because this is a mass casualty situation that came from the war zone now into the civilian world. So the biggest challenge was wrapping those bodies, trying to find storage for those bodies as we actually had them piled up. The other challenge was also taking care of my employees. I have over 100 employees now. And of course, I also had to make um, capacity in my operating room as well as in the recovery room, and then deploying my staff, since we closed the operating room, to only doing emergency surgeries as well as urgent surgeries, and moving them throughout the entire rest of the medical center. That became very challenging. And now that they're back, one of the biggest problem now is dealing with post-traumatic stress disorder that a lot of them now are exhibiting from their initial experience. So those are the challenges. And I'm going to pause here and give you back Sir Control and everyone else an opportunity to dive in.
I was gonna come up with the being the challenge, but I'm sure we'll come back to that. Sister V, tell me about yourself. You work with children, right? You're on the children's
Mhm.
side.
Yes. Good night, everyone. I'm Violet Humphrey, and I'm a pediatric nurse. I'm here in the Children's Hospital in Valhalla. And our challenges for this COVID was it was more psychological and watching the parents and the restrictions because the parents couldn't come and visit the children as they would like to. And you put yourself in their position if you have a sick child or sick baby in the hospital that you can come and visit it. It really does something to the parents and to us as workers, and we just try to help them to deal with it and to get through it. So it has been challenging, but not as challenging as what I'm hearing. At least, gratefully, we did not have, none of the children were tested positive. They have had exposures like from visitors coming in at first before we had the restrictions, but it has been challenging. Getting the PPE and everything like that has been it's a different healthcare nurse. And then I thought about Florence Nightingale last year. She had predicted that's why the theme was the year of the nurse, and I thought about that. It's certainly a different time that we're living in. But
All right.
children are resilient and they just go for it. So I'm grateful that I was able to help in that capacity and will continue to help.
Well, thank you for that. I'm glad that you don't have some of the kind of experience that some of us do have, but we appreciate you sharing that with us. We have some people who are working in the hospital and some work at nursing homes and different experiences. So I'm gonna see if Alderine's phone is slowed down yet. I'm just checking that. Yeah, there's terrible amount of sound behind you, so we won't be able to hear you with all that in the background. So let's go to Sister Lady and see what her experience is in the nursing home. We're gonna have to get some adjustment for you, Alderine, because we can't open your microphone. There's just too much coming from behind you.
Good evening, everyone.
Good evening.
Good evening.
Good evening.
Yes, for me, it was very exhausting.
It is
My name is
one
Ladine Hall.
target.
My name is Ladine Hall. I've been a nurse for the past 16 years, and I've never experienced anything like I've experienced with the beginning of the COVID era and what we're still going through right now. I work in the nursing home. I'm not in the hospital. I work in the nursing home. So I guess I'm bringing a different view from everyone else. It was very exhausting. challenging, as everyone else said, and very heartrending for me. I've never put in so many IVs, and it was so hard to see my family, because in the nursing home, you spend 8 hours a day, and so the patients become a part of your family, because you spend 5 days or 6 days a week with them, and so we were a little family. And as Sister Maxine said, the bodies, we had to have trucks outside, plugged in. What you call those again?
Refrigerated.
The refrigerated trucks. Yes, that's how much bodies we have piling. Sometimes we have to keep the bodies in the room with the AC on blast because you have nowhere. It was an experience, something I really don't want to go through again. And talking about PPEs, the facility took so long to give us the right gear to work with. I know at one point I must have had it because I couldn't smell, I couldn't taste. I feel as if I was floating on air. But still, I know I had, and we weren't being tested then. So can you imagine how many people had the COVID, and we didn't know because they weren't doing the testing as yet. So just to piggyback what everybody said, it was a challenge and still is, especially in the nursing home. Because sometimes you don't know who's coming in and what they have. So
Well, that
it was
was
a rough year.
that was the biggest problem when this all started, because it took the nursing home with a storm.
Yes.
And, the nursing homes were mostly affected, maybe because of the vulnerability one, the underlying
Yes.
issues, number two, and the families coming and going, and nobody knows who is bringing and who is leaving.
Exactly.
So, that was a major problem. But we're gonna come back to that. But thank you for sharing. I don't know if we can open. We're gonna give Lorena a chance. It slows down.
Yeah.
It's still night in the background, but we're gonna give you, as we can get you a couple minutes.
Yeah, hi. Good night. I have a air conditioning thing that keeps going off, and I have no control over it. Good night, everyone. I'm Algerine. I've been a registered nurse as long as Ledine. We went to school together. I currently work in the hospital. I left her in the nursing home. So I've been working on the med-surg telefloors, and there's been so much that I've seen with the COVID, I'm not even sure where to start. I can remember at one point when it hit, most of the med-surg units had COVID patients. So we had to set up like a tent outside of the hospital to host people that didn't have it. And we really didn't have a problem with the PPE. The only thing is we had to wear like a mask for like a week, and we had to keep cleaning it, leaving it in the locker, which I'm not sure how safe that was.
It was.
At one point we had to be reusing our gowns, the face shields. But my biggest challenge was, I should say, I had a patient that actually coded, and I didn't know she was COVID positive. So I had her for the whole shift, going in and out of the room, taking care of her, just wearing the regular surgical masks, no PPE. So after she coded and they did their x-rays, they realized she was COVID positive, because initially when she came into the hospital, she was negative. So when they tested her, she was positive, and I was in the room, a lot of other nurses, and we didn't know that. So I've been exposed so many times. I'm surprised up to now I still haven't tested positive, because
Because they
I've been
didn't.
exposed so
Maybe
many.
you've been through the duration and didn't
I,
test.
I have, yeah.
They didn't test her at the time.
Check your
Yeah,
antibodies.
I'm surprised it hasn't come back positive because, so much exposure.
Yes.
I mean, even when you're going to take care of them, you're in your PPE, but you still never know. You just still never know. But it's been a challenge. But what I do, I showed for myself, I showed especially the elderly, I showed them a lot of compassion because like some of the PCTs, they would take the trays in the room and they wouldn't feed the patients. They just leave it there. Some of these people, they can't even feed themselves. So I stood there and I fed them and I made sure, like the ones that couldn't feed themselves, I made sure that they ate all the time. I never left a COVID positive patient hungry. So yeah, I showed them a lot of compassion, the ones that couldn't help themselves.
Well, that's why you're a nurse.
Maybe. I mean, not everybody has that kind of compassion though, because I've
Exactly.
seen people that, that didn't give the care that, everybody, they're scared of it. So, you rush into the room, you rush out. But I mean, you got to have some compassion. These people, they need care. So I
not
did the
everyone.
best I could. I'm still doing it.
And
And not everyone in nursing for nursing.
No.
right, and I agree, and yeah, and unfortunately, I guess that kind of going off again. So
And sometimes I even went into rooms and I forgot to wear my shield. I have on the N95, but I forgot to put the shield on. And then when I get out of the room, I'm like, whoa, I didn't have a face shield on.
that's
So
the hard. That's the other
it
compassion.
happens.
All right. Well, thank you. We're gonna hear some more from the wonderful nurses and caregivers, but here we have Dr. Kathy Ann, and she's joining us directly from Jamaica. So,
Yeah.
and the one doctor on the team is joining us from Jamaica. Welcome, Dr. Robinson. Tell us about yourself, your story. Tell us a bit about yourself and what has been your experience with COVID. Maybe not the same intensity, but who knows? At your level of profession, where do you fit in, and what are your responsibilities when it comes to that? Oh, sorry. Oh, I'm sorry about that. Somebody can unmute yourself too. So, but thank you. Go ahead.
Hi, everybody. Good evening.
Good
And,
evening.
it sometimes sounds a little cliche, but thank you so much for your service. You have done so much and lived through it. And that's awesome. Okay, I'm sorry. There's somebody else's phone beside me. And it's hard. I'm so sorry. So, from my perspective, I am an infectious disease doctor, and there are only 2 at my hospital. There are very few in my country. And so all of a sudden, everybody's looking to you to tell them what to do, how to do it. They're watching you to see if you're afraid and if you're going to do what needs to be done, or if you're going to run away kind of like everybody wants to. And so I think one of the hardest things for me has been trying to, in a sense, be that sort of pillar of strength for the team, keep them calm, help them to rationalize their processes and not let fear take them over or make them do things that don't make sense. Because sometimes, in an effort to protect ourselves, we might be like, okay, well, more is better. Sometimes we have that idea that more is better. So, okay, more coverage, more PPE, maybe more tape to tape it all down. And sometimes that puts you more at risk, because then how do you get it off? So sometimes a challenge for me was trying to just be strong for everyone else. And it's not just be strong at work, it's also be strong at home. everybody then says, okay, well, you're the doctor, so you know what's going on, you deal with it. Or, okay, I need help, so you're the person who can help me. So then you kind of don't belong to yourself anymore. But I must say that God has been really good to us. I can't imagine, even though we have been through our own deaths, our own challenges, we have, relatively speaking, had some sort of space to breathe at times
Mhm.
where we are, because the pandemic hasn't been so bad for us as it has been in New York and so many places in the States and other countries. And so I really feel it for the other places that just are looking at death after death beyond even the capacity to deal with the dead, much less to be able to deal with those who are alive and to keep them alive, because that's what we want to do. We want to keep everybody alive and, you know, get them back to being fully functional and normal and able to take care of themselves and their family. So that part has been challenging, but I am grateful. It has, it's showed us our divides. It's showed us, you know, where as a team we were breaking apart so that we could fix it. It's also shown us where our strengths are and where we were able to come together and work together in ways that maybe we were not depending on each other as much before, but now we had to overlap our duties. Doctors and nurses had to be doing some of the same things so that we could help each other to get through what we were going through. And that was something that I really love to see as we work together as a team, that we are supporting each other so that it's not about, okay, you're a nurse or I'm a doctor or you're a patient care assistant or anything like that. It's okay. We're all in this together and we just have to make sure we all get through it as safely as we can. So that's been something that has been good in the midst of how bad it can be and how bad it has been.
Mhm.
And so that's kind of been some of the challenges and some of the good things.
One of the question I want to one of the question I want to ask, because when the COVID thing came around, I was in the hospital too. I was working as a chaplain then, so you know these people that I work with know. I was there as a chaplain, and I have seen it. I've seen the impact of it. I've seen the impact of COVID on the emotions and the psyche and the uncertainty of even the nurses and the doctors, because when it just came around, people weren't sure. Every day we were getting briefing every day of and we have to make adjustment as the CDC, you know, gives more information of what this thing is and what it can do to you and how you should approach, what are the precautionary measures you need to take. You know, as we every day we were getting briefing and we have to be adjusting accordingly. You know, so personally from where I was, I've seen the impact on the emotions and on the psyche and on the fear of people of I have to do it, but I'm afraid to do it. And what happened if I don't do it? And what happened if I do it? So I want to get a quick circle on that. You know where I was in the hospital where some of these nurses work, and they eventually turned our floor into a COVID floor. You know, so our unit became a COVID unit. So there were COVIDs everywhere. So you know, so I'm gonna go back a little bit and say what from a personal standpoint, not from the patient perspective, or want to take care of the patient, but personally, how has that affected you psychologically, and how many have been tested that I actually had it? So let's start back from my twin sisters up here, because that's where because we haven't heard from them in a long time. So let's go back to the twin sisters. Personally, how taking care of yourself and having to go to take care of the patient and the fear of getting it. How does that affect you psychologically? Let me see if I have you on it. Okay, let's go. Go ahead.
I wasn't scared of getting COVID. You know, I was more scared for my patient. Um, you want to do a lot for them, but you were unable. It was so much at the same time. What else?
All I know is that our floor, it was bad. It was bad. We were overworked. We were mandated to work overtime. We were short staffed. There sometimes it was like 3 nurses with 42 patients because the other nurses were out sick. We were drained, but we had to do our best. There are times that the patients them were coding back to back. I remember on Easter Sunday, I'm a new nurse, but that day will always be one of my worst days psychologically, emotionally as a nurse because the entire floor back to back, it was just cold blue. And even up to this day, I think about all those patients that coded, and sometimes when I go to bed at night, it's like the image of their face flashed before my eyes, and it just breaks my spirit. Like sometimes when I walk past those doors, it's like I'm reliving that moment. And what hurts me the most is that we are putting so much effort to save the public, to make it safe for them. And when the CDC, the governor, health official asks the public just
Yeah, we're losing them a little bit there. We're gonna get back to Angie and um and Shanique. And let's go to let's go to Cindy as we get back to Angie. We lost them a little bit. So let's what has it been like for you emotionally? Having to yeah, we
It's been very, very difficult. I don't. I think one time when you came onto the floor and you were always asking me, oh, like how's it going? How you feeling? And I think that one day I was just like over and done with it. I was like I I felt like I had lost faith, and you were like, no, you can't lose hope and you can't lose faith. And it's not that I lost it. It just with everything that was going on, like they said, we were a COVID floor. I'm used to, patients coding, you hear them get on the loudspeaker, code blue. But in a day, I work an 8-hour shift, and I'll never forget one day, um, we coded. I mean, it was like one after the other. I mean, we had 10 codes maybe in a matter of, you know, 2, 3 hours. I'll never forget. I always try to team player on my unit, and we were running out of code cards. That's how bad it was. I would go downstairs and change the cart, and by the time I came back upstairs, it was time to change it again. It was a very, very scary, scary moment.
Wow.
Um, I don't think I was ever afraid of getting COVID, um, but to see, it still affects me now, even though we're at a different moment now. But these people, died alone. If it wasn't a nurse in the room, they died alone, and I can only imagine what it was to be behind a closed door and your last breath. Nobody
mm,
was there. 2 years prior to the whole COVID, I lost my dad, and I guess I want to say I had the privilege of being there with him
Mhm.
until he took his last breath. And
Mhm.
I can not imagine, even though my last memory is of his last breath, but I have that. I have that. Many family members don't have that.
mhm.
So it was rough.
Wow. Yeah, as you said that, I kind of remember when I had to encourage you along, and that we can't quit. This is a tough time because that's where the chaplain comes in when he's got to be there for everybody and try to protect himself, but not to be there for everybody. Um, Uh, so, well, thank you, Cindy. I can hear that emotions coming out there right now. Just even now, reflecting, it is still the emotion isn't gone because COVID has not gone either itself. COVID
It's
is
still
still
here.
around, and COVID is like it's still coming back with more force, and so it is kind of scary. The only good thing that I see here now is that most of us are aware of what COVID is and more educated of how to protect ourselves and how to deal with it. So we can at least do more to protect ourselves. Although you don't see it coming, so you can put up all the things, but you never know where it's coming and how it's gonna get you. But I appreciate you sharing that, and I hear your emotion ties into that, Cindy. Um, Max, tell me about what's your. I know you're a soldier, and soldiers are tough and all of that stuff, but soldiers are still human. So tell me about your emotional. What do you call it? Roller coaster, if there be, how it has been for you. Talking about bodies. I'm not even talking about mine because my experience. I could even come back on that, but I want to hear from the nurses, not from the chaplain.
Thank you for asking. So first, before I answer your question, and for everyone that is watching, my husband just reminded me that I did not introduce myself. So let me take the time to do so. My name is Maxine Lindsay Shillingford. It's not Lindsay Marshall. It is Maxine Lindsay Shillingford. So now that I've gotten that official correction out of the way, so to answer your question, I tapped into a lot of my experience. As I've stated in the introduction, I'm used to mass casualty experiences. You know, I've written mass casualty standard operating procedures, policies. I have actually do many exercises regarding mass casualty. And right before we even knew what we were dealing with, back in February, we conducted a tabletop exercise. And so, yes, I am very familiar in how to manage mass casualty. But again, you're now in the civilian realm dealing with it, and you're dealing with civilians who are not used to these kind of experiences. So for me personally, I tapped into the skills and the resources that I already had, that I already knew. One of them also was the chaplain, and secondarily, giving information. So I've listened to, my two colleagues, the twin, as you call them, and also Cindy, and that is the PTSD that I talked about earlier, because my staff were going through that. Giving information became one of the biggest things that we had to do to be able to get not only myself through it, but also through to my staff in giving the right information, in being there for them, in supporting them. And I see a lot of information in the chats, and let me acknowledge the folks, Bishop, that I see in the chat, Sister Anahan, Sister Christine sent me a message earlier. Good night to everyone that is listening, and thank you guys so much for your support. I am actually a COVID recovered. I actually was infected on the job. Then I eventually, of course, naturally infected my husband. So both of us were sick at the same time, being home. And while I was home, still working from home, still managing my staff, still managing my unit. We talk about building that capacity where we have to turn other areas into overflow in building that capacity. So personally for me, the emotions were a lot of mixed emotions, but I was able to utilize the skills that I knew. And that biggest skill was my experience, being able to manage my staff, being able to manage the patients as well as the family. We had to become very creative, and at the same time tapping into spiritual aspect, which is utilizing the chaplain and also allowing the staff to express themselves in their own way, whether it's spiritually or through meditation, whatever way that they're able, to be able to cope with this pandemic at the same time, dealing with this entire mass casualty experience that they've never experienced before.
How about your emotions?
It was mixed emotions. There are a lot of mixed emotions. Taking care of the patients, and as well as dealing with their families and giving information. Initially, there were not a lot of information, but as again the science unfolds and we're realizing what we're dealing with, were able to give not only the staff, but the families that particular correct information, because there were a lot of wrong information that initially, were put out. But when you give folks the right information, they're able to become more compliant on understanding, what it is that we're dealing with. So for me, Bishop, it was a lot of mixed emotions.
I can only imagine being affected personally and affected your husband. And the stories never end. Thank God. More people affected with COVID than we would ever know.
Yes,
Thank God,
and have
and a lot of
died.
people survived it, and maybe you're wondering why I'm not catching it, but maybe the antibodies are putting up resistance, and we didn't even know we got it, developed antibody, and now we are resisting. So if that be the case, to God be the glory. We rejoice on that anytime. All right. Uh, Alderine, let me see if your microphone it can be open now.
Ugh.
Yeah, it's still making some noise, but
You
yeah.
hearing a lot of noise?
It paused a minute, so go ahead now and tell us about your emotion.
Ah,
Yeah, oh yeah, we gotta get back to that. You gotta plug the machine, plug it out, plug it out. That's the only way to get rid of it. We can't turn you on because we have to plug it out. It's just too much noise. So the doctor, tell me about, because I know you talk about people got to be there for each other. And the teamwork. I think teamwork came to being more during the COVID period because people were looking out for each other, because we all realize that we are all vulnerable. Nobody is exempt. We can all catch it, so we're looking out for each other. What has it been like for you in terms of looking out for others and others looking out for you?
Well, I must say that I had a lot of support. I when so we would rotate um our duties. So we would be on for a period of time, and then we'd be off doing other duties for a period of time, and then rotate back. And whenever I was on COVID duty directly with patients, because the COVID duties with separate from patients are every day, but when I would be on COVID duty with patients on the COVID wards, then at those times I would have to separate from my family because my son has some conditions that would make him more vulnerable. So then my husband and my children would kind of move out. And so we would separate because our apartment is really small, so they couldn't really stay there. There wouldn't have been a way for me to protect them by staying away from them. And so I would have good support from friends and family. People would tell me that they're praying for me. And that helped a lot to know that there were people who were thinking about what I was going through and were there to be supportive, even if they weren't in front of me, that I could see them.
Mhm.
Because at times you feel really alone. Sorry,
Mhm.
I didn't have any intention to be emotional, but it comes when you don't expect
Okay.
it.
Mhm.
Mhm.
And
Okay.
so one of the things for me was with the patients. So many people, when they're in isolation, they're by themselves, they need help. Sometimes they're totally bored because they have nothing to do, especially if they're not terribly sick that they they can't think of being bored, because some are so sick that they can't, but there's some who they're not sick enough that they can't also be bored, and they are missing their family. They want that interaction, and sometimes they just want somebody to talk to. And you're wrapped up in these hot things. I mean, we don't have AC on our COVID wards, so you're wrapped up in PPE, it's hot, you are sweating constantly, you're soaked by the time you come out of the ward. And so you can't really stay too long. But there would be times where maybe in taking care of the patients in one time period, you might be going 4 to 6 hours straight in the heat in all this plastic.
Mhm.
And so that would be difficult because some people couldn't tolerate it. We had, I think, one doctor collapse because he just couldn't tolerate all of that and the dehydration that you would go through because you're in PPE. It's not like you can drink anything or do anything to kind of keep yourself going. And I remember one of the first patients who came to the COVID ward, the first set weren't really ill in March when things started for us. And one patient was so stressed out by the separation from her children. And she was just constantly seesawing in her emotions. And she wasn't sharing what she was going through. So it was difficult to support her. And to be fair, in the beginning, when everybody was more afraid, a lot of the staff would be in and out as quickly as they could. So, because they have to do it multiple times as well. And so she wasn't necessarily getting as much support from the staff, but her fellow patients were trying to support her. And I remember one of the other patients who was kind of trying to be the sort of background mom for everybody on the ward at the time. She was younger than most of the other patients, but she was trying to be, encouraging and strong for them. I remember one day she broke down and she just needed a hug. She couldn't do anything. She just started bawling. And so I hugged her and she was bawling all over me for a couple minutes because she was just so stressed and she felt so alone. And when you do those things, sometimes you don't think about it, or you think about it for a second, but it's what somebody needs. And sometimes that part of caring is more important than what risk you may or may not be at. But then afterwards you stop and think, okay, did I put myself at more risk than I ought to have? Am I now going to be a risk for my family? Did I do what I needed to do to kind of protect myself as best as I could? And sometimes you second guess yourself as well, because you're doing all that you can to protect yourself, but you can't not care for the patients because you could be one of them. You could be there on the other side going through what they're going through. And so sometimes you have to think more about what somebody needs than what might be in your headspace. Sometimes you just have to put that aside and say, okay, what can I do to help these people who need my help now? And you kind of worry about it later, because later is when you have the time to think about it. So you deal with it then. But in the moment, sometimes you have to put it aside and just do what you have to do.
Wow. Lorraine, can we hear you now? The COVID story.
Maybe not.
Okay, so we can hear you now. So use the time while
What you were asking
we're
about
talking about
the
the
emotions, right?
emotional attachment. How
I think my biggest what's the word I'm looking for? The thing that affected me the most was the families not being able to visit the patients. I think Cindy had mentioned that. That was very devastating to me, because as the doctor says, you can imagine somebody being sick, you're not able to see your family day after day, week after week. You're not sure if you're going to see them alive. You can't talk to them because even if the family members call, you could only talk to the nurse. You're not able to go into the room and have the patient take the call. So I think that affected me most of all, not having the families. The families weren't able to visit. I mean, most of the time they died alone, as the doctor mentioned. Luckily, everybody that survived, they eventually went home and they were able to reunite with their families. But it was very difficult with them being there without no family members. So whoever, the older people, some of them were confused, the patient with dementia. So they don't even understand. So, I tried to help them as best as I could. The ones that understood, I reassured them that their family member called, and I relayed whatever message they left. Sometimes families would, they would bring food or items to the lobby area, and they would send postcards. I remember I had a patient and one family, they brought in like 10 postcards, and I stood in the room and I read all the cards to the patient, and he was very happy. And, this is a COVID patient. So, I stood in the room, I read the cards, and, I think that made him feel, felt better. So
It,
I think that's one of the things that affected me the most. As everybody else mentioned, that not, the families not being able to see the patients.
from my and by the way, we're coming down to a moment where we're gonna, if somebody is watching and listening, wanna maybe on the YouTube or and wanna ask a question, you can pose that question. I'll try to have the nurses to answer that and the doctor to answer that. But talking about the emotional, I'm not sure where the feedback is coming from. Talking about emotional connections. I recall at least one incident. There's so many from a chaplain perspective that I have encountered, sometimes being the person who's on the last call. Somebody talked about code blues. I remember when every now and then the intercom sounded code blue. And during that time, scarcely anybody was making it through code blue. When the code blue called those times, it was like almost like a death sentence. You were almost sure that it was gonna happen. But I remember one person. And those who are in my unit remember one of many, but this one still stays in my mind, and this are many, many, many months after. And she was in room 16. She was in room 16 and she was on the ventilator. She got out the ventilator and she was doing good, and then she relapsed. And nobody was coming to see anybody. And the nurse said to me, Chaplain, could you just talk to this lady, because I think maybe you could help her because she's not coping well. And she was not on the ventilator, but she had the heavy mask on with the oxygen, and she could barely speak. But she said to me, I am not afraid to die. I am just afraid of being alone. And that got me. And then we were kind of getting people to connect with their family members via FaceTime, etc. And she had her phone, and then I said, you want to talk to your family? She said, I don't have any charger, and I have an Apple phone. She had an Android, and I couldn't help her. And she said, my phone is dead. So I couldn't make connection with her and her family through her phone. I couldn't get into her phone, and so to talk about to make connection through my phone, I wanted to help her with her phone. And so I promised her, and this is what got me. And I walked my unit. There was no charger to help her with. I promised her that I'll bring a phone charger for her the following day. That time you have to line up long time and before you get into any place. Anywhere you go, you have to line up long time and wait to get in. This time is everybody. And I went to 3 places. After work, line up and eventually got in, line up, no charger. They all sold out. Line up again, going no charger. Line up again, going no charger. And I couldn't get a charger to help her the following day. When I came back and checked on the census, her name was not on the census. And that is still living with me until today, because I tried hard to help her, just to make connection with her family, and I did everything I could, and I couldn't help her. And I still see her. She was a 62-year-old Caucasian woman. I cannot forget her. 62 years old Caucasian, and I'm still seeing and hearing her voice that I'm not afraid to die, but I'm just afraid of being alone. And I couldn't make the connection for her. I tried, and I'm still feeling that right now. So, uh, wow, the COVID thing is not going away. Anybody have anything that you want to say to us that we did that I didn't ask? I here's one of my questions. One of my questions is, what would you say from a nursing doctor standpoint, caregiver standpoint? What would you say is your worst moment with a patient? Your worst moment. And when I come to the worst moment, and then I'm come to it, what would you say is your most rewarding moment? So, what's your worst moment? Around the horn, what's your worst moment? Who's going to take it? The sisters?
Yeah.
What's your worst
I
moment?
um My worst moment was when a patient coded and the family is calling at the same time, and we're in the dilemma like, do we tell the family exactly what's happening? I remember we had a patient, like the daughter was on the phone crying while we're there performing CPR on the mom, and the daughter keep asking her, is my mom going to be okay? Is my mom going to be okay? We're breaking down. We're there performing CPR, crying, and we're trying to be that voice of reason for the daughter to reassure her that we're doing our best and, like, stay strong for your mom. But unfortunately, the mom did not make it, and that me, like, up to this day, that whenever I pass that room, and if I'm not strong, I will like step off the unit, and sometimes I'll break down crying just remembering that lady.
Mm. Yeah, I can imagine something that sticks. Angie, what you said
And
your worst moment?
I would say my best moment was one
Give me the worst one
when
first. Give me the worst moment.
worst moment when you want to go to the bathroom, you want to eat, you can't do either of them at the same time. That was worse. I mean, running out of. I think another one was running out of what?
We ran out of everything. We ran out of bed space. They had to be intubating patient from the parking lot. It was crazy. Like, it even at one point, like, our unit, it was like we became the boss of the hospital. Like, we were telling people, this is what had to be done. We're gonna do it this way. Like, doctor looking to us, the managers were looking to us. Like, people were like, they were scared to come to our unit, but then at the same time they were intrigued to know what was going on. Like, they were sending us their best wishes. And even though we're scared out of our pants, like, we didn't know, like, as one of the colleagues said, that we were unable to see our family. I have my 4-year-old. I could not go home and see my 4-year-old. He had to stay with other family member. And we be coming home, like, leaving work, finish our shift 7:30, mandated, sometimes leaving work 1 a.m. to get up back to go back to work 7 a.m. the next day, doing it all over again. Admission coming on, like, I remember a patient coming on the floor, and before the patient came on the floor, you heard that patient breathing, like, that hard labored breathing. You could be at the end of the unit and the patient, and you're these heavy breathing. And no matter how we supplemented this patient, put in the prone position, nothing works. It was like someone took a fly repellent and sprayed it. That's how people were dying. And I don't think anyone should ever have to experience that. That's something I would not wish on my worst enemy. And I hope we don't have to experience that again. It's not normal to be seeing human beings dropping like flies out the sky. It was just crazy.
I hear you loud and clear. Sister Max, what was your worst moment? What you say would be your worst moment? A single moment. Sorry. What you say with your worst moment?
That's okay. So for me, my worst moments are twofold. because of the dual hats that I play, so to speak, in the civilian realm. So the worst moments is actually shared by my colleagues who have talked about those bodies where the families were not able to come in. But I also mentioned earlier about the creativity. Thank God for the technology today that we have, where we're able to do FaceTime for those that have, those iPhones. And if they didn't have the iPhones, then of course, because of where I work, we, have the ability to have multiple different technology. So that was one of the worst moments. In addition to that, managing the staff, people were both physically and emotionally exhausted. I had staff who could not go home. Of course, we had the accommodation for them. Um, in addition to that, the staff who had to learn new skills, because that is not normally the environment that they work in. So to get them competent in order for them to be able to manage patients outside of their normal day-to-day unit that they normally work in, managing them, motivating them, taking the term from my husband, in addition to ensuring that they have the supplies. I might be one of the more fortunate individuals. We did not have issues with supply. Again, as a federal entity, we ensured that the staff had the supplies that they needed. Best moments is discharging a patient who is a COVID recovered as they're leaving the facility, and also having staff debriefing and listening to them and getting them to that point where mental exhaustion now has now turned into that sense of accomplishment. As I'm watching the chat, someone named Lady D talk about the selflessness. Thank you, you're a selfless individual. That term is so powerful when you look at what the healthcare workers and essential workers have accomplished in managing fellow human beings through this pandemic. The scripture gave us a perfect example of what it means to be selfless, of a story that we all know today as the Good Samaritan, gentleman who became ill. And so many people have passed. One person stopped, and that one person is represented by the panel here tonight, as well as many people who are listening. That compassion that you have came from that selflessness, where God had allowed you to be able to choose this profession because in time he saw this pandemic. Nurse Humphrey made mention to Florence Nightingale. Along with Florence Nightingale, there was a Jamaican woman named Mary Seagull, whereas they managed those men and women in the military, predominantly men, during the Crimean War. They encountered the very same pandemic, but in the form of a cholera. And so a lot of the science we learned from those nurses that we have actually now adopted and have become the foundation. So I'm saying all of that to say that selflessness comes with that compassion, and you have to be able to be compassionate in order for you to do this particular work. So the best moment, having the patients being discharged, recovered, and just watching my staff going from that sense of hopelessness to that sense of fulfillment as they're able to manage those patients.
All right, thank you. That was a lot in that package there. All right, I'm just running around pretty quickly. Sister V, what would you say is your highest moment? I know you're not in the heart of the COVID like everybody else, but dealing with it. What's your best moment? What's your worst moment? With the children. Right there. Hold on, Sister V. Let's go.
Okay.
Go ahead.
I just thank God for all my colleagues here that have shared their experiences. I didn't have to go through them, but I felt as if I was through it with you all, and that's what makes us, so special, so different as a nurse. And one of my worst moments in through all of this was just to see how tireless the staff was working, the staff members. And as a manager, I couldn't just stand by and just watch them. If it's even to stand at the door to give them a drink of water, to give them, help them put on their PPE, because it was so tiring. And so we just worked along with the staff. Stand by and just watch.
Somebody is listening to themselves there, so you got
Yeah.
to turn off your listening phone.
To give them, help them put on their.
Yeah, you got to turn off what you're listening to because it's
I
coming
don't
back
know
to you
who is
later.
listening.
All right, keep on going.
Yes. So then, and another one of the sad moments is just when we see some of our co-workers who got exposed, and then they too had to be into the hospital, and and we lost about a couple of nurses through COVID, through that, just being exposed because they were there. So it's really hard when you look at those things. And then one of my best moments is to know that I was there to help and to give some sort of satisfaction, some hope, especially to the parents. As I said, I'm a parent myself, and just to have your newborn or your children in a hospital, and you can see them, and you're calling, you're finding out how they're doing, and even if they try to have some sort of symptoms, you're wondering if they're or COVID positive, just the fear of the unknown that really gets people.
Mhm.
But through it all, God has helped us to come through, and we're still going through. And I really appreciate all of you for your experiences. And I really feel that I'm in it with you all. And as nurses, that's what we do. We're just down in the in the trenches, and we have to. If you never know that this is the right position for you, the right profession for you, then you would just you would just give up. We would just give up. We would not be here.
Yeah, thank you, Sister B. That's why you can't be a hireling. You have to be called to the thing. You can't just do it for the. If you're just in it for the money making, then you'll be running,
Yeah,
running.
wrong business.
To be
So
right.
I still got a few people that I hear from. If we can get some a minute answer, 1 minute answer. See if we can get. Doctor, tell me what's your worst moment. Sorry, hold a second. Because some of these nights are coming through. That's why I gotta keep muting people. So, what's your worst moment?
So my worst moment was after being the only doctor covering the COVID wards for a 3-day period where I couldn't go home. I would get like 2 hours sleep in the early morning for 3 days straight. Because some stuff was going on and there wasn't any other support. And that was my worst moment. Just being in that position where it felt like everybody has abandoned you and you're alone.
Wow. And since that you had that quick worst moment, what's your best moment?
So my best moment was seeing the junior staff I work with being happy and hopeful going about their work. That was my best moment. Seeing them manage better because they felt supported.
Thank you so much, lady. What's your worst moment in a minute and your best moment following that? Well, a second. Let me make sure that you're hoping. Go ahead. Your audio is gone. Not from my side. And until she figure that out, let's get to Cindy. What's your worst and your best moment, Cindy?
I think I would say the worst moment was we had a patient, young. I think I don't know if she was an assistant principal, and I just remember the day. I always made sure that when we had a new COVID patient come into the room, that the phone was working so that we can at least maintain communication with the patient ourselves as staff members, but also with family. And I remember speaking to her, and she was telling me, "Oh, I can't breathe. I need the nurse." And when I came back the next day, she had passed away. And I mean, she was, I don't know, about my age, 37, 36 years old, young. She was from our community, came in, just with the COVID, but otherwise was, as far as we knew, somebody healthy. And being that I just had spoken to her a couple of hours, just to come back the next day that she was gone was a little bit of a
Mm-hmm.
reality check in that COVID moment.
Yeah.
I think the best moment that we had was when we finally, after 2 weeks or about 3 weeks, our first, COVID case that came in, that we discharged him. It felt very nice as a unit, even though I didn't take care of him, that we successfully discharged our first COVID patient off. I think they had followed up with him, a week later, and, he seemed to be still on the recovery phase. But I think that was validation that, we had done something good. We were able to save one.
Mm-hmm. Wow. Lady, can you hear me now? Can I hear you? I'm still not hearing you. You turn off your volume again. All right. So a question was asked. In the meantime, if we can get Lady audio back. A question was asked. Lady D asked, for people who are recklessly exposing themselves to multiple people in small clusters, how can you convince them of the harsh realities of this virus?
So, Lady D, if they have not already seen the over 400,000 people who are dead, and each of my peers tonight have shared experiences where they have actually helped to wrap the bodies of one of those 400,000 individuals who have died, then those cluster of individuals are not living in this reality, and they're not living on this planet. They are somewhere else, and they don't have the ability, so to speak, to be able to connect from that human perspective, which is what links all of us, that humanity. And so that would be my response to your question. They're not in this world. They're on completely different planet. And unfortunately, we have had so many people who have died. And if they're not able to see that, then, there's a problem with them mentally.
As you said that, I know we're just about exhausting the time, and this is just good that we could keep on going. But I think maybe we'll have to come back and follow up on this on another time. But I remember, a couple of things that stands out in my mind, and maybe some of you can relate to that. 'Cause I think the doctor said that we got to be there for each other, try to be strong. I remember we got a call. The chaplain got a call to the CCU because we were paged to go to the CCU, and this nurse was she broke down, and she was the one who was considered to be the strength, the
Mhm.
one who everybody looked to on the unit when they are broken to find strength. And she broke down, and because one of the nurses actually, they were going so fast, so hard, so and not eating, not taking care of themselves, like Angela said, not taking care of themselves. And she actually, while she was in the CCU room taking care of a patient, she collapsed,
Mm.
and she ended up in the emergency room. And this nurse who was supposed to be the strong one, she broke down and she needed help. So I went there and tried to help her to pull through the moment. And I cannot forget that I've gone back and see her, and she's done well after that. But those are some of the things that happen. I saw one doctor, right? And doctors don't, forgive me, doctor, not to label, but the doctors don't normally talk to the people. They don't want to talk to chaplain like that. They just go about their business like they don't even see you. Nurses sometimes communicate with chaplains, but doctors like go about their business and get their thing done. But I've seen some good doctors. But I remember one doctor came out. I was, the code blue was called. I rushed to the room, and I was there, and they tried to resuscitate the lady. They did everything. The room was filled with doctors and nurses, and everybody was working, and I couldn't get too close to, so I didn't know what happened. And the doctor came out of the room, and I asked him how was it going, and he said to me, she didn't make it. And he said it was overwhelming for him because he did not expect that she would make it, and he broke down, and I could virtually felt like his head was on my shoulder, and I had to be there to help him to pull through that moment because so many people have died, but that one hit him. Sometimes it's just this one hit you that you weren't expecting, and that one you can get past that one. So there are many moments that we could talk about, and I know your experiences have been so much, that and I'm so thankful that you've joined me on this meeting, this conversation, and I appreciate it so much. And is there anything that anybody would like to say that you want to just pass on before we go, before we say thank you again, and hope that you'll be coming back um, to talk to me again? I don't know what Shillingford is saying. I don't know what.
So, so what Shillingford is saying is that this is serious. This is not a hoax. This is not a joke.
Okay.
Contrary to what we have now come to have seen from people in position of power, people in position of trust. And so my final words are that this is not a joke. COVID is still here. It has not gone anywhere. If you have not seen the news tonight, there's another new variant that was identified right here in New York. So of course, that's what viruses do. They mutate themselves. And so the bottom line is I would encourage folks, if you have not gotten the vaccine, please get the vaccine. Johnson & Johnson vaccine is coming out. That's a one-shot dose. However, the Moderna, the Pfizer, those are two-shot doses. Moderna, 28 days in between. Pfizer, 21 days in between. So I would encourage people to get vaccinated and take this seriously. It is not a joke. We continue to have people dying every day. If you look to see what's happening in Los Angeles, where my fellow service members are out again putting bodies in freezer. So this is not a joking business. This is real life.
For real.
If anybody still think this is a hoax, then they're not in reality. I could say that they're living in another world. Um, Boy, I wish we had time just to keep on going. I remember when I saw our emergency room. It was, to me, I have one description for it, like a flea market of suffering and death. That's the only way I could describe it. And what happened in New York when it was ground zero is what's happening in Los Angeles now. So we know exactly what that looks like, feels like, and the consequence of that. My goodness, this has been good. And by the way, you talk about the vaccine. I can't wait. I can't wait for it to be ready. I almost have my arm, my sleeve almost roll up ready and just walking to find the nurses ready to put in.
I'll come vaccinate you. We have started vaccination since December. So
I'm just waiting until they say my level.
your category
My
eligibility.
category is ready. I'm certain to find out because I'm going to go get it. And having said that, some of you nurses who are not taking it yet, and some of you who are afraid to take it, next week Wednesday, I'm gonna have a scientist. I'm gonna have Dr. Kenrick Semple gonna be with me next week for the whole time, all by himself. He is a scientist, a pharmacologist and toxicologist, and he works with the FDA, and he's gonna be with me next week, and we're gonna talk vaccine and all of that stuff. So if you better tune in because we're gonna have a conversation on that, and I hope by then I can hear where in Westchester that I can get my vaccination, and I'll be hunting it down. So don't allow yourself to be brainwashed by some people. I went to see my doctor there, and the doctor assistant was saying, "Oh, they said that if you take the vaccine, make you turn into a zombie." And
No, that's not true.
I say, yeah, I can't wait to get mine. So zombie or no zombie. I'd rather be a living zombie than anything else.
But that is the only way out of this pandemic, Bishop, and everyone who's listening. The vaccine is the only way out of this situation that we're in right now. If you're listening to talking about scientists, an African American woman, young 34-year-old, Dr. Corbett is behind the Moderna vaccine. And that is very, very significant. So this is the way out of this pandemic, is to get vaccinated. I see my husband logged on. Thank you for your support, sir.
Actually, thank you for sending me that clip, Maxine. I'm gonna actually, after this, I'm gonna share that clip that you sent me with everybody else who is in this program. I'm gonna share it so that they can take a listen of that. Thank you, Shanique. Thank you, Angie. Thank you, Maxine. Thank you, Violet. Thank you, Kathy Ann. Thank you, Cindy. Thank you, Alderine. Thank you, Liddy. You guys have been wonderful. I appreciate it so much. Thank you for taking the time to spend this time with me. And I appreciate all those who are listening and watching. I appreciate you. Every Wednesday, God's willing, I'll have somebody else or some other group to talk to. As you say, let's talk with the doc. We're going to have things to talk about. COVID is not going away. We're going to talk vaccine after you get yours and tell me what the experience was like. So thank you, Doctor, for joining us from Jamaica. I appreciate you so much. I look forward to seeing you sometime soon. By the way, I personally appreciate your service to your community. I really do. I've told the nurses that over and over and over again on my unit, that how much they're appreciated, and sometimes they are overlooked, but they are greatly, greatly appreciated. God bless you. You are doing a great work. You're not hirelings. And the reason why you fought through this COVID moment and still where you are is because you are called to ministry. You're called to ministry, and you're using that to minister to the health need of the vulnerable and the susceptible. And even when you're fearful of your own life, you still go above your own emotions to try to help somebody. Those are good things. You will be rewarded. If you haven't been rewarded yet, keep going. Your reward is coming. Yeah, the person who dying next to you might not be the one who will reward you, but hang in there. Your reward, your reward is coming. I appreciate you, Elder, all of you. I appreciate you. Keep up your good work. Keep up your good work. I think I remember one of my notes that I left with my unit, because I've been writing notes and thoughts, and reminding people that you are the reason why people walk out of here alive. You are the reason, and so you are the reason why people are still alive in where you work, and your contribution has impacted those lives, and only heaven will know what the end result would be. But for then, until then, take care of yourselves. Be good. I don't have to encourage you to be good, because you have already been good nurses, patient, steadfast, committed to your duty. God bless you. I'll see you again on Let's Talk with the Doc. Have a good evening, buddy. Be safe. Still take care of
Good
yourself.
night.
Good night, everyone.
Good night, everyone.
Good night, everyone.
All right. Appreciate you, everybody.
Okay. Bye-bye.
Bye bye.
All right. That has been good.